Hi folks, Mayor Kevin Davis reporting to you from the Charlie Ward Room at City Hall, right off the Mayor's office. This is named after a long-serving, rather famous former city councillor who at the time would have been an alderman, Charlie Ward. His picture is behind me. So today we heard from Dr. Bannicky. She has a press conference every Tuesday and Friday afternoon. What she told us today is that we now have 14 confirmed cases by lab testing. That's up from 11 on Friday. 3 are in the hospital, 2 in ICU. The rest are recovering at home. Of significance, 1 came over the weekend, was community spread, and since then 2 more. So a total of 14, 3 they don't trace to someone who traveled, but someone who became infected through community spread. The significance of that is she said that this is a critical week because we'll know this week from the data whether everything we've been doing the last 2-3 weeks regarding community spread and preventing it, the flattening the curve, is working. She said if it isn't working, more restrictive measures will have to be considered. And I'm guessing, I'm not an expert, but I'm guessing that would be potentially the number of people in a public gathering going from 5 to 2, maybe a mandatory stay at home. So we don't want to go there. We don't want our civil liberties further restricted. So it means let's pay attention to what we're told and let's observe the rules we're given. 6 feet apart, 2 meters. Not washing your hands continually, not touching your face, and staying at home unless you're required to leave because you're an essential worker or you have an important trip to make to the grocery store, but you can get your groceries delivered. Yesterday, I made an order in respect to parks, and that was about 2 or 3 hours before the province made a similar order. We didn't know the province was going to do that. And we made that order because Dr. Bannicky told us in the morning, the Emergency Operations Center, that because of the 1 case of community spread, it was important that we take further measures to control potential public gatherings beyond 5, and also to control the potential spread of the virus through playground equipment. So based on that advice, I made an order yesterday, and I'll read it to you so there's no misunderstanding what it actually says. So the order prohibits the use of amenities such as playground equipment, picnic tables, benches, shelters, exercise equipment, pads, and courts located in any municipal park or any property that's owned by the City of Brantford. So it effectively closes all municipally owned or operated golf courses and sports fields for play. However, walking, jogging, taking your dog for a walk are still permitted on city-owned trails, parks, and public open areas. Although you have to observe any other bylaws, such as with dogs, they have to be leashed. And the reason for that is because Dr. Bannicky feels that it's important that for those who are healthy, who can leave their home, that they have the opportunity to exercise and have fresh air. That helps boost the immune system. You're going to ask, I'm sure, well, how are we going to enforce that? Well, last Friday night, the province told us with no prior notice that bylaw enforcement officers can now enforce provisions under the province's emergency plan, and that's the no public gathering beyond 5, essential, non-essential businesses. It does not allow us to enforce the travel isolation ban for returning travelers. That's federal. That's a federal act under the Quarantine Act, done by the Government of Canada. We can't enforce those laws. So since Friday night, the bylaw department here has been working overtime because this is requiring them to totally restructure and refocus from enforcing ordinary bylaws to primarily enforcing the provisions of the province's emergency plan. They've been doing a lot of work in cooperation and consultation with Brantford Police Services and the Health Unit, which has its own investigation team. The enforcement will be up and running tomorrow, and that will include a line that people can report problems, and it'll be, I can't give you the phone number, it'll either be the general city phone number with an extension, or it will be a dedicated line. That'll be announced tomorrow. And so what that means for you that have let's say an ordinary bylaw infraction you want the department to look at, we're probably not going to have much time to do that. But the hope is that the message going to people who are not observing the rules and guidelines given to us by public health to do it, because if you don't, there's a minimum fine, $750. So hopefully we won't be fining very many people, and that most everyone and everybody will observe the rules that we have, because in doing that, not only do you protect yourself, you protect all of us. A couple of other developments. Farmers Market, we've decided that it will not open this weekend. There are too many issues involving maintaining that distance of 6 feet 2 meters. The Farmers Market's a very confined area. Hopefully we can work all that out. It may open the following weekend, but stay tuned. There'll be more on that. Also, I serve on the board of the John Noble Home. We received a report yesterday that there have been no incidents of infection at the John Noble Home. In fact, they have a very strict protocol there. You can't get in, no visitors, and even the staff are screened each day. And they actually have a separate wing for residents who have a cold or a flu, and those who do are taken to that area of the home. And of course, a very rigorous program of disinfecting. So I think the John Noble Home, the one that I'm most familiar with, has done a great job, and there are no problems there. Lastly, what I talked about last night, what we're facing, and the one thing that Dr. Bannicky said this afternoon, she mentioned that a lot of the lab results are coming in very quickly now, and they're getting through the backlog, and those are provincial labs. And she said of the test results that came in over the weekend, there were 3 that of confirmed cases, but 80 to 100 with a negative test result. And so does that mean we can go, okay? No, we can't. It's critical we continue our efforts to flatten the curve, and so we've said it many times. That means washing your hands, not touching your face. Don't go out unless it's absolutely necessary. If you have an isolation ban, making sure you observe that, and of course, generally just to stay at home. And so let's all pull together, work together. If we stay calm, stay focused, stay committed, we'll get through this together. So have a good evening, and stay tuned tomorrow. I'll have another update on some other issues.